So in our office, we get a lot of people that are either thinking about surgery or maybe they've even already met with a surgeon. And I always tell people, always check with a chiropractor first before you ever make that final decision to have surgery. And I'm going to give you a couple different statistics on why that's so important. In 1993, there were 150,000 spinal fusions that happened in the United States. In 2007, that number had ballooned to 350,000 in the United States. Now, each one of those surgeries is $75,000, and spinal fusions are a different type of surgery than say what we call a discectomy, which is where they just shave off the piece of the disc that is actually started to bulge into the nerve or is actually ruptured outside of the disc. So this is what a healthy disc would look like. This is the nucleus, and then this is the area that or the fibers that hold that nucleus in place. When things are working the way they're supposed to, that nucleus is nice and full and hydrated, and the disc is hydrated, and it moves the way it's supposed to. When the disc starts to become less healthy, it can actually these fibers can start to tear, that disc can start to move towards the outside, and it can actually bulge back against this nerve. If it gets bad enough, it can actually rupture outside of the disc, and then that piece of the nucleus can actually just sit on the nerve itself. Now, going in and cutting this piece of the disc out is usually the most common surgery, but a spinal fusion is where it actually takes two vertebrae and it fuses those together. Now, the reason why those are such problems is because less than half of those surgeries actually end up being successful. So if you've ever heard of failed back surgery syndrome, it's 12 months after you've had back surgery, you actually are either in the same amount of pain or worse than you were when you went in for the surgery. Now, there was a study that was done in 2012 of some workers that had low back pain. Now, they split them into two groups, and the workers that had a chiropractor as their first point of contact, they only ended up getting surgery 1.5% of the time. The group that had surgeons as their first point of contact, they ended up getting surgery 42.7% of the time. So always try chiropractic first. It's a conservative type of treatment that if it can help, that's great. If it doesn't, you're still in the same place that you were before. You still have surgery as an option, but surgery should be seen as a final option. So in our office, we not only are looking at the spine, but we're also looking at the surrounding areas, the musculature, the discs, the person's lifestyle. Do they sit at work? All those things go into account of whether you're going to be a good candidate for surgery or not. And with spinal fusions, they're really successful for things such as like an accident. Like if you had a healthy spine before an accident, or you have what's called a spondylolisthesis, where the vertebra can actually move forward or backwards and make the spine unstable, then they're really successful. The ones that are not successful, though, is when you've had chronic back pain, you probably have some dysfunction in the spine. Going in and creating surgery in that environment, you still have the underlying cause of the problem, but now your vertebra is fused and you have no motion at that segment. So that creates a lot of problems down the road, and those are the people that usually end up with the failed back surgery syndrome. So if you got any value out of this video, make sure you like or comment. If you know someone that has low back pain and maybe is thinking about surgery, share this with them. And if you have any questions, just leave it in the comments below, and we'll see you next week.